So welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have an amazing guest today. This is Mical Knafel, and Michael is a student doctor of physical therapy with a strong foundation in strength training, patient care, and rehabilitation. After completing an undergrad degree at Hope College in Michigan, Michael pursued a doctor of physical therapy degree at University of Miami, where she honed her clinical skills and developed a passion for enhancing the quality of life of patients through targeted physical therapy interventions. With a particular interest in oncology, Michael is dedicated to supporting individuals in their journey through cancer treatment and recovery. Her professional interests also extend to holistic rehabilitation approaches that focus on both physical recovery and overall well-being and fitness. Outside her professional work, Michael is an avid enthusiast of snow sports and bodybuilding, activities that reflect her commitment to maintain a peak physical health and performance. These hobbies complement her professional ethos of resilience and wellness, which she aims to bring to patient care. So, Michael, welcome to the podcast.
Thank
Thank you
you.
for being with me today
I'm
here.
glad to be here. It's exciting.
Yes,
I've heard lots about it.
exactly. So tell me what inspired you to pursue physical therapy.
I think my story is very similar to a lot of other people's. I was an athlete growing up. I played about every sport you could. As a kid, my parents always had me involved. When I was 14, I tore my ACL, my medial, and my lateral meniscus playing volleyball in warm-ups of our first game. So that was embarrassing, but obviously had to go through PT for that. And then I rehabbed. That was in October, and I came back and I made varsity softball in the spring. So I loved my physical therapist, small town Michigan, great camaraderie. And then I think throughout my schooling, because I was from a small town, if you're smart, you go to med school. So that was always my plan. In my undergrad at Hope College up in Michigan, I was on the pre-med track and I did some internships with the ophthalmologist. I was in all the classes. I loved my classes, but the camaraderie that I experienced with my PT wasn't there. And I'm a typical Midwesterner. I love the camaraderie and chatting and this and that. And I just think with the internship I had and then all the experiences I have with classmates who were involved in like the pre-med course, I didn't really get that. And so I got into strength training, and courtesy of my now husband, he played college football. I started, I was on the track team at Hope College, and so a lot of strength training there. And then I got involved with the physical therapist there and kind of changed my path. I was really, really nervous because of kind of expectations that people had for me. But when I told my mom's PA, when I told her, she was like, "Oh, PTs," because she was an ortho her whole career. So something that was really daunting on me, changing my career path, actually ended up just being a blessing in disguise. So it's kind of what led me here.
Awesome. And
Yeah.
you will be a really great one. I can guarantee you that.
Thank you.
So what were your expectations coming into this internship, and how have they changed since you start?
Yeah, they were, I think daunting is a good word. I was very nervous about kind of the communication skills I would need. I've always been a talker, typical Midwesterner. My previous one, I was up in Washington, D.C., and when I was telling them I was going to outpatient oncology, everybody was like, "Oh, that's so tough. I'm nervous for you, and it's going to be really sad and depressing." And, so I kind of had that mindset approaching this internship. But then I think literally within the first hour of being here, I quickly found out that was not the case. So definitely changed perspectives very quickly. And it is not like a depressive or a daunting thing at all. It has that camaraderie, which I've always been looking for.
Yeah,
So,
and it's very rewarding, actually.
yeah.
Can you walk us through a typical day with the oncology internship?
Yes. So we always have expectations for what the day will kind of bring, right? We have a surveillance program that we work with, which I'm sure you mentioned on the podcast before, for lymphedema development post, operation lymph node removal. So typically we have a couple surveillance patients throughout the day. We have head and neck patients that we see. So we kind of go through chart review, and then they come in, we expect to see one thing and we see another, and we kind of just transition and shift our mind frame, which I think in all forms of therapy, you kind of have to be fluid in that regard. So, yeah, definitely working a lot with manual throughout the day, Therax, exercises, different things to address, different situations that people are in, whether they're going through chemotherapy, radiation. You always have to address what they're going through at the time being rather than what they've been through in the past.
Perfect, perfect. What are some of the biggest challenge that you have faced working with cancer patients?
Yeah, I think we've had a couple of tough discussions, not even regarding prognosis, but just about, support systems that they may have. And I'm not local to Gainesville or this area, North Florida at all. Really, I'm from Michigan, and I'm familiar with South Florida because I go to Miami. So I think having the resources to give others is difficult because I'm not familiar with the area, but obviously everybody here has been helpful in offering me avenues to find those resources. But I think the difficult conversations is something I had to get used to and be comfortable with. But again, I'm chatty, so I think I can always have a positive spin on things. And luckily our patients are wonderful and very accepting and letting me learn.
So it will be a really challenged, kind of tough conversation, what you say.
Yeah, I think there's two sides to everything. So one is, if our plan of care isn't being as effective as we want to, we've kind of honed in our skills and nothing is helping, whether it's the lymphedema or, the patient doesn't have the full buy-in, and it's like, okay, well, maybe our physical therapy road has ended. And because we can treat you 1 or 2 days a week here, but if you don't do the work at home, then you're not going to see the results. And I think that patients coming to terms with that is a very difficult conversation to have, and is one that we have had here. And then the other side is patients who, have tried anything and everything, and the cancer is back and it's in their hip and it's here. And so I think being understanding of their situation, but knowing that I've never been in their situation and I can't understand their situation, and if they have a glimmer of hope, through one thing, who am I to take that away from them? And so just kind of roll with it and let them lead the way, but contribute as best I can to the recovery.
Yeah, exactly. Well said. Again, like I always tell them, right? It's all about quality of life, no matter what, life throws. It's just, okay, like how you feel now and how can you want to keep it feeling as well as possible in the middle of all these cancer treatments, right? What specific skill or techniques have you learned that are unique to oncology physical therapy?
Yeah, I think you offer a lot of manual therapy and that I obviously have used in the past, but it's more from an ortho MSK perspective rather than an oncology recovery perspective. The biggest one that I was not super familiar with, and we had like one guest lecture at Miami going through it, is the TMJ rehabilitation, post head and neck cancer or radiation, things like that. The TMJ dysfunction that will come with that. So I think you being certified in TMJ and then having students being able to experience that offers another avenue for treatment that I otherwise would not have had.
Excellent. What role does physical therapy play in improving cancer patients' quality of life?
Quality of life. Number one, it definitely helps with the mental, just having the 45-minute, whether you're talking, whether you're not, we're hands-on with patients. And I think there's something to be said about energies and being hands-on with the patients. Even if, it's not what they needed, I think that it's proven that, hands-on with patients is targeted. And it helps you kind of with the relationship. So yeah, definitely with the mental, it helps. To obviously the physical recovery part, we have a chemotherapy hip protocol. We get the oxygen to the tissues, chemo and radiation is going to target those tissues better. And that's, evidence-based. So everything we do is obviously evidence-based, and it's going to help with the recovery, mobilization, joint mobs, and manual therapy is going to get them moving. And a lot of integumentary work that I didn't expect to do post-op, wound care, and not that I'm packing the wounds, but, scar mobilizations, things like that. I didn't really anticipate I've never had this many post-op patients, so it's really cool to see like, oh, that wound is still draining, or you still have your drains in. So very new to me, and I've enjoyed it.
Okay. How has this internship influenced your career goals?
Yeah,
I'm
so
excited about this one.
I came into this internship. I really didn't know what to expect. I'm a bigger person. I've had big hands, so I've always liked manual work, and I didn't expect that much to be with oncology. And so that's really honed in my skills there. I love that we get to see post-op and that every patient is different, even though we're doing surveillance. You know, they might come back at 15 months and, oop, I have lymphedema, or my range of motion is actually impacted now, or I have this webbing. What does this mean? You know, and so I really like that, even though we're doing, you know, all have a similar goal for our surveillance or our head and neck patients. Everybody's different. And so I definitely think I have an interest in oncology moving forward, and Durley's proud of that. I did not anticipate it, but I think that this type of program that Durley has made here at UF can definitely, I don't know if as good as I could, but replicate it, you know, elsewhere, and that it needs to be a thing. You know, this type of holistic rehabilitation needs to be nationwide and not just at UF. You know, we have patients from all over the state, from Georgia coming here, and I think it just needs to be more accessible because the outcomes speak for themselves.
Excellent, very good. So, so from people out there who that all the students who hear this, or my ex-students and are my colleagues, my purpose in life is really professionally is definitely trying to expand more the oncology rehabilitation part of it. We're growing and growing more of it. I'm glad that see how things are moving along. I'm just looking at just CSM just happened this past weekend, and I know was even on the orthopedic part, they were talking about breast cancer. So I see how we just really evolving more and see the need, right? Is your typical, I always tell my students, is the typical ortho patient who is going to come to you maybe 5 years later, 10 years later, that had some kind of cancer in the past that create issues, and you knowing what all these cancer side effects can do, and being more conscious about it and see the whole picture of different things that you can approach these patients are going to really bring much better outcomes. So that's why I always kind of like to get my students coming in here to have that little seat in their hearts and head, like, you can really promote these oncology programs, and let's have these expands all over. So it will be great to have somebody say, oh, you're moving to Michigan, I want you to go and see, Mical in this area, or moving. I have already some students who has been all over, or colleagues who is great to know. Hey, you're moving to Denver, I have no exactly the right person for you to go see, or, Texas, or whatever it is. So that's kind of really neat to see. What resources, book, course, mentors have you most helpful in your oncology PT journey?
Yeah, so obviously you have all of your continuing education resources here available to the students, which has been incredibly helpful, especially with, spinal accessory nerve paralysis and things that we see there. A lot of different techniques we can utilize, nerve mobilizations, Gary Gray technique out of Michigan, different things like that. But I think there is something to be said about, Durley's passion for oncology and physical therapy. I think it is infectious, and couldn't have asked for a better mentor for this 8 weeks. And I'll get emotional about it, but I also have a guest lecturer in Miami, and Anna Mae Laylis. She works for Sylvester Cancer Center. She was our guest lecturer. I think we had her 2 or 3 times throughout our schooling, and she was very much like you, just passionate. During her lectures, she would tear up. She had those connections with patients, and I didn't understand it until now. And so I wish I could, if I see her again in Miami, I'll tell her, and I'll say, yeah, I totally understand it.
I get it now.
Yeah. So
that's awesome.
I think it's definitely, obviously you can have all the resources in the continuing education, but the passion speaks for itself. So I think the mentors that you find in this realm are infectious, like I said.
Awesome. If you could give advice to students interested in oncology PT, what that will be?
Just be open. I did this because I didn't really know what I wanted to do. You know, I have my sports background. I had a strength and conditioning internship at University of Miami with their D1 sports that I loved, and I got to kind of bridge the gap between rehab and strength training, which obviously with my bodybuilding background, I love the strength training aspect. So I was a little apprehensive when going into oncology, but I was like, I don't know if I don't like it until I try it. So I tried it and I loved it, and it'll probably be my career. So just
Awesome.
just be open.
Okay,
Mhm.
great. What is something about oncology rehab that you wish more people knew?
I think just the positivity and the camaraderie of it all. It's not going back to the beginning of our time here, it's not a negative, a daunting task. It's you're helping them with quality of life through one of the hardest times in their life, whether they have a phenomenal support system or not.
Mhm.
Ultimately they're the individual going through the experience and the rehab, and I think getting the buy-in from that and helping them throughout that, you just feel like you made a difference throughout the day. So I hope, whatever aspect of physical therapy you pick to spend your career in, you feel that way. But I think that oncology here offers, I don't, if you're open to it, you'll feel it. So
That's great. Well, that was really fun. Again, I always get, you say, no, I'm very passionate about I do, not necessarily in oncology, but just our profession itself. And it is great to have a student who is so willing to take it and is so eager to learn, and
Mhm.
it's just motivate you even more, right? So you
Yeah.
can have a student who's like, oh, whatever. Yeah, another technique. Okay, good, that's good. Versus somebody who's really open, wants to learn. So that as well motivate us to even teach more and learn more.
Yeah.
So has been super fun having you. Sorry that this is coming to an end this
I
week.
know. Thank you for
But
it.
I'm sure we'll continue crossing paths and continue being in touch.
Yeah, we'll have to be.
Yeah, but thank you for doing this with
Thank
me. I
you.
really appreciate it.
Yeah, of course.
All
Thank you,
right.
everybody.
All right. See you later.